an ER doctor, but I'm also a parent, and sometimes I even second guess myself when it's time to go to the emergency department.
We are seeing a lot of mycoplasma pneumonia, and this person wants to know, when should we go to the emergency department or ask for a chest x-ray or a mycoplasma test? So Dr. Beachjim, can you take it away?
In general, if your kiddo is having shortness of breath or difficulty breathing, if they're starting to get dehydrated or have decreased urine output, or altered mental status, like they're starting to get confused, or your gut just says something's up, I don't feel right, it's probably time to head to the ER. When it comes to chest x-rays, we're usually looking for something like pneumonia, we're looking for fluid in the lungs or inflammation, we're looking for a big heart size, we're looking for a fluid around the heart or around the lungs, or air that gets trapped between the lung and the chest wall. The people we usually get chest x-rays on are people that have respiratory distress or difficulty breathing, really low oxygen levels, or kiddos that have had a fever for a long time, or a persistent cough more than like a couple weeks. Pneumonia is often a secondary infection, so it usually starts with a viral infection, and then a couple days later you develop a pneumonia. So usually in the first 3 or 4 days, you're not gonna have the pneumonia, but if the fever and symptoms are going on longer, that's something we consider. We're seeing a lot of Mycoplasma pneumonia cases, but it's kind of a tricky name because it can cause pneumonia, but doesn't always. Most of the infections are going to be mild and get better on their own without treatment in a couple of days. So if symptoms are getting more severe or the symptoms are lasting kind of a long time, then we consider testing for Mycoplasma, because then we would consider treating for it. And if you have any questions at all, your pediatrician is the best place to start.